Welcome to our webinar, Prophecy plus Partnerships plus Passion equals Successful Outcomes. My name is Tom DeSantis from Advanced Practice Strategies. We provide our web platforms, Gnosis and Prophecy, to over 500 healthcare facilities to help build the best patient care teams. I want to thank you for joining our presentation featuring Trinity West Michigan, Mercy Health St. Mary's in their Prophecy story. Today we have a mix in our audience, including current Prophecy clients looking to expand how they use their assessments, Gnosis clients exploring Prophecy, plus nurse leaders who are learning about APS and Prophecy for the first time. So when planning for our 30 minutes, we tried to think of the questions that you as a group might have and shaped our agenda around them. First, how can we better hire and retain nursing talent? We're going to talk about the tools that are available today. What is Prophecy? How does it work? We will be providing a brief overview. This is not a product demo, but we're more than happy to do that at a later date for you on a personal level. How do clients use Prophecy? We're going to let our special guest today tell her story. You'll hear from her. What impact does it have? We'll look at specific outcomes. I mean, these are things that you're already measuring, that are already on your dashboard. And how is it different? We'll explain the holistic approach to assessments that no one else can offer. At this time, I'd like to introduce our presenters. Felicia Sadler is our Vice President of Quality and Performance. She collaborates with clients specifically during the hands-on implementation and training to provide strategic solutions to increase nurse retention, promote efficiency in onboarding, and improve nurse satisfaction scores with Prophecy assessments. Felicia has been a registered nurse for over 30 years and served in numerous leadership capacities, including healthcare administration, where, with her passion for continuous quality improvement, she specializes in improving clinical excellence. She is currently on ASHRM's Education Development Task Force and has served as a board examiner for the Tennessee Center for Performance Excellence. Welcome, Felicia. We are also very pleased to have Teresa McGuire with us. As the RN Residency Program Coordinator at Mercy Health St. Mary's, Teresa has spent the last decade focused on helping new graduate nurses have a seamless transition to practice in the acute care environment. She has interacted with nearly 400 new graduate nurses in their inaugural nursing role and has learned some tips along the way to help them have a better experience. Over time, Teresa has learned that passion and partnerships are integral to the success of new grads. Teresa has a master's degree in nursing and education. She is a board-certified nursing professional development specialist and proudly serves as the president of the Michigan Nursing Professional Development professional organization, where she interacts with other nurse educators and collaborates to glean out what organizations are doing with the goal of learning and sharing best practices. Welcome, Teresa. Before we jump in, I wanted to explain who we are as a company. As I mentioned before, APS is a technology company that features two assessment-driven solutions: Prophecy, our hiring and onboarding product, and Gnosis, our education and risk reduction platform. Both focus on innovation dedicated to helping clinicians achieve their highest potential. But as you know, today we're here focusing on Prophecy. And Felicia, at this time, I'd like to ask you to start by telling us why Prophecy was founded in the first place.
Absolutely. Thank you, Tom. Prophecy was originally developed actually as a retention tool to assist organizations to identify and retain top performers within their organization. With the latest average rate of nurse turnover being around 16.5%, we know that this can add up quickly when considering turnover costs, which can be as much as $88,000 per nurse. We also know that losing top performing nurses can add enormous cost to an organization. Prophecy was developed as originally as a hiring tool to assist many organizations across the country to improve their retention, as I mentioned in the previous slide. As part of the selection process, Prophecy can assist in identifying and selecting high-performing nurses, placing them in roles that they are well suited for. In the onboarding process, Prophecy can also assist with utilizing a data-driven approach. It can assist organizations with more effectively and efficiently onboarding as well. And then continue to support a new hire in their success through personal and professional development, such as in a clinical ladder and/or succession planning pathway. Nearly 1/3 of all nurses in the U.S. have taken a Prophecy assessment. We are in over 400 staffing agencies and in many health systems across the country, with just a few of those listed here. We also cover 40 unique areas of clinical practice, In addition to our specialty-specific assessments, we also have competency assessments to augment a leadership development track where we have a preceptor, charge nurse, and clinical nurse manager competency assessments which are available. We are the only assessment company that takes a holistic and a validated approach to assessing nursing competencies. Prophecy assesses competencies in 3 critical areas, one being clinical, which measures medication administration, the ability to multitask, take initiative, prioritize, report transitioning, as well as problem solving. For the situational assessment piece, this particular component takes into account and measures critical thinking, conflict resolution, patient rapport, customer service. And then our behavioral assessment includes components that measure accountability, teamwork, adaptability to change. All the critical components that are contained and measured in our assessment can assist in the provision of providing safe and effective patient care. Prophecy takes all 3 of these components and statistically weights them into what we call a Prophecy 1-score report, which can be very helpful in predicting a nurse's success into a particular clinical specialty or role. When it comes to outcomes, there are numerous ways in which organizations measure success when it comes to prophecy implementation. We're highlighting here just two organizations who have demonstrated successful outcomes, one being in pre-hire and one in the onboarding process. The organization you see on the left has demonstrated a reduction in turnover from 24% to 4.5%, and one of our organizations out in California have actually reduced their onboarding times from 18 weeks to 12 weeks through identifying specific needs and targeted learning opportunities. We are honored to have Teresa with Mercy Health St. Mary's with us on this call to share her amazing story of successful outcomes with you all. So welcome, Teresa.
Hello, thank you, Felicia and Tom, for inviting me today to share with you the story that Mercy Health St. Mary's has had as they've implemented prophecy for a hiring tool. And so the purpose of this presentation is really to share with you our outcome data. And of course, I'm an educator, so I always have objectives. So the 2 objectives for this presentation are to realize the value that prophecy has had on our organization and to discuss with you the strong connection between HR and nursing services. Mercy Health St. Mary's is a 283 acute care bed that's nestled downtown Grand Rapids, Michigan, which is the 2nd leading city in Michigan. We have more than 4,500 employees, where 1,000 of those are registered nurses. And if you look at our BSN complement, we are probably about 71% of those. We received our initial magnet designation in May of 2013. We're about 6 months away from submitting our redesignation document. Like many organizations are struggling to recruit top talent, as with the nursing profession has a shortage looming on the horizon. Our greatest pipeline for new hires is our new graduate program. So I'm going to focus our talk on new grads. Wanted to share our prophecy timeline with you. Our chief nurse officer, who is a very transformational leader, and in my perception, she kind of likes sitting on the edge, the cutting edge of technology and innovations, and she loves to adopt new processes. Liz recently attended an AONE conference where she met Ron, the founder of Prophecy, and quickly after she returned from that conference, she collaborated with our HR professionals, and together we brought Prophecy on board on a trial basis. And interestingly, it wasn't too long after that trial basis that we brought Prophecy on board. We spent, from the initial time Prophecy was implemented, to about 20 months gathering some baseline data, developing a database, and just helping us to understand some of the data that we had. When Prophecy first started, we had some high-level education from the Prophecy experts, and this small group consisted of maybe 3 to 4 HR professionals and 3 to 4 nursing education professionals, where we began to understand Prophecy. So during that 20 months, we really wanted it to be a year, but as you know, in the healthcare environment, sometimes priorities get pushed side. So our year quickly became 20 months. So we have 20 months worth of baseline data. We started to realize the power that Prophecy had as we implemented and shifted from our homegrown nursing internship program to a full-fledged commercialized residency program that we use, the Vizient program. So because we started to realize the power that Prophecy had, we wanted to expand the knowledge and the expertise of the nurse managers who hire new nurses. And so we brought Felicia Sadler on to provide some education and training to all of our nurse leaders who were involved in the hiring process. And that June 23rd and June 24th is the same day education that is repeated. And then from that, we quickly decided to revamp some of our processes, and I will share that with you in more detail, but we have the clinical review team and the clinical interview team. So when you look at this, the point of that I'm trying to make with this graphic is to share with you that Prophecy is sharing their time, talents, and expertise, and they're beginning to make a difference on a national level, as you saw in those slides as it relates to turnover rate, orientation time, and satisfaction of nurses. So they're making a difference one organization at a time, whereas St. Mary's is making a difference one nurse at a time. And then the next slide will just highlight a little bit more of the stratified data as we begin to look at our process at Mercy Health St. Mary's. And for me, it all starts with a vision. And our vision of nursing at Mercy Health St. Mary's is we provide excellent nursing care to those entrusted to us. So our vision, part of our vision, is to make sure that we recruit and retain top talent. And the picture that you see up there is a picture of our professional practice model. And our professional practice model specifically calls out the need for professional development for new nurses and nurses at all levels of development. And our strategic plan also calls out to assure that new grads are having a successful onboarding process. So at Mercy Health St. Mary's, the title of this presentation is really Strong Partnerships and Passion. And what I really want to underscore is the nursing department could not have achieved the great outcomes we had if we did not have strong partnerships with our HR department. So if I can just explain that for a second. So at Mercy Health St. Mary's, we believe that recruiting and onboarding top talent first starts with hiring for our culture. So before we fully implemented Prophecy, in the old days, our HR department, which has the skills and the expertise of hiring and recruiting top talent, the HR department brought forward all the best candidates that they thought were for the nursing positions that were available, and then the nurse managers would look from the pool of those candidates and then make the decisions to hire. Now, with our strong partnerships and understanding Prophecy, we have HR seek and find candidates that are a cultural fit for Mercy Health St. Mary's. Once they pass that cultural fit feeling and evaluation tools, then those candidates are invited to take Prophecy. When those candidates take the Prophecy, then we convene the clinical review team where HR assembles a database, and in that database, the spreadsheet, it has all of the nurse candidates, names, where they graduated, some different demographic variables in their Prophecy scores, their areas of interest where they want to work, and then we compare the opportunities or the availabilities of those positions that we have at Mercy Health St. Mary's. So nursing and HR are partnering together, where HR brings forward the best candidates for culture fit, and now nursing has taken the wheel as it relates to who is the best fit for the nursing unit, because nursing is now using their expertise and their understanding of Prophecy to help position the nurses for success as it relates to their first job. Now, we also use Prophecy for onboarding experienced nurses as well, but I'm only talking about the hiring process for our new grads. So it's really important that our vision aligns with our sense of purpose, and the sense of purpose for new grads is they want to be able to identify where they celebrate their best selves. So it's really important for new grads that they have an opportunity to do what they do best every day. And prophecy helps us to identify those characteristics that help them to be successful in those 40 different clinical areas Felicia was referencing. So I'm proud to share with you some of our data as it relates to that. So this is a graph that shows our RN turnover data for Grand Rapids, Michigan, and it's broken down by fiscal year, and our fiscal year is July to June. So this graph covers from fiscal year 09 to fiscal year 17, but since we're halfway through our fiscal year, I also annualize the data. So right now, current day, we have a 2.5% turnover rate, but if we kept going at the pace we're going, we would be at 10%. So you see we're consistently below the national average, which is represented by that red squiggly line that I tried to show that there's some steadfast variability as it relates to that. So we are below the national average. And fiscal year 16, which is the third bar from the left, the 11.8, when I looked at maybe why the data was going up or why the turnover rate was going up, it showed that we had a few more nurses retire than we had in years past. We had some additional nurses leave to travel, and we had some resignations in lieu of terms, and then regular turnover where nurses are looking for new opportunities. On the next slide, I drilled down the data to show for all new grads who are departing Mercy Health St. Mary's with less than 2 years from fiscal year 14 to fiscal year 17, because industry standard is really to look at new grad turnover at 1 year, 2 year, and 3 year. And I had great data for new grads less than 2 years is where I wanted to focus. So if you look at that data, we see that some of our new grads are turning over for unsatisfactory performance and relocation, new job opportunities, and the rest of those in the Pareto graph are pretty commensurate with what you find. But what I really want to talk about is the 5 nurses who departed for unsatisfactory performance. When I pulled that data, what's interesting to me is that 3 of the 5 nurses had taken the prophecy assessment, and the prophecy assessment very clearly indicated the behaviors that these nurses exhibited and why they were had unsatisfactory performance. So I believe that prophecy did a really good job of predicting the nurses' ability to perform in those given roles. The next slide talks about our new grad retention data from when we went live with the residency program. So we've had an internship program for the last 12 years, and the last year and a half has been a residency program. And so we have currently 8 cohorts who are in the residency program. It's a year-long program. But what I want to show you here is that our retention rate for our new grads is pretty good. It's pretty steady. It's almost 97%, which is awesome. Cohort 1, we had 3 nurses depart. 1 was for health reasons, 1 was for unsatisfactory performance, and the 3rd one injured her back. So the next slide is something that I'm wildly passionate about, and this is where prophecy hits home for me. So as a nurse educator, as a professional development specialist, I want to make sure that nurses have the opportunity to do what they do best every day. And prophecy is a tool, an evidence-based tool, that allows nurse managers, educators, HR to make smart hiring decisions. One of the ways I quantify success with hiring, a smart hiring decision, is looking at the Casey Fink survey, which is a national, reliable, valid tool to measure transition of practice at hire, 6 months, 12 months, 24 months, and 36 months. And it was just called to my attention, sorry, Dr. Fink, that I left the E off your name. But one of the questions on this Casey Fink survey is, I am satisfied with my chosen specialty. So one of the interventions that our department employed since going live with Prophecy was looking at the KC Fink data, and we had an intervention in place. So cohort 1, 2, 3, and 4 was the standard process where we did not use the clinical review team, and we began to use the clinical review team before we brought on board cohorts 5, 6, and 7, and 8, and 9. And the purpose of that clinical review team is to really look at the Prophecy scores and help identify where nurses celebrate their best selves. For example, my experience has been that most nurses know where they don't want to work, but they don't necessarily know where they do want to work. Or conversely, you have nurses who, ever since they were a little girl, taking care of their teddy bears and their dolls, they always wanted to be an ICU nurse. So that's kind of the two levels of spectrums that I've had in my 12 years of experience working with new grads. So when we brought Prophecy on board, I was wildly excited that we were able to look at the difference between when we help nurses make smart choices about where they're going to spend their inaugural year in the nursing profession, as opposed to just placing nurses where they thought they wanted because it's what they've always wanted to do. You see that our satisfaction as it relates to the chosen specialty has consistently gone up. So what that means to me is that nurses are able to enjoy their job. And when nurses enjoy their job, the literature is very clear that all great patient outcomes are associated with that. So that is our KC Fink data. But behind all of those numbers is a person. And I have two potent and compelling stories to share with you. And for me, every time I say these, they give me goosebumps. But we will call this nurse Liz. And let's say that Liz initially was placed in the ED department because Liz always wanted to be an ED nurse ever since she was little. And she did her rotation there as a leadership student, and she felt connected to the fast pace of the emergency department, and she absolutely wanted to work there. So in our baseline data, we ran some Prophecy results, and Liz wasn't necessarily a good fit for the ED. Sadly, over time, as Liz transitioned to practice, she realized that the ED wasn't the place for her. She would spend countless hours in my office in tears because she wasn't able to celebrate her best self. Her best self is where she can spend time with patients, holding their hand, sharing their life stories, understanding where they're coming from, do lots and lots of patient education. Well, when you're pressed with competing priorities to save lives, that's not necessarily always a good fit. So we made the hard decision to allow Liz the opportunity to move from the ED after she successfully passed orientation but wasn't thriving. We moved her to the senior adult unit where in months the smile returned to her face, the passion for nursing had returned, and this nurse is special because she received 10 DAISY nominations in one calendar year, and she just received the October DAISY Award for nursing. So imagine if we wouldn't have had the opportunity to move Liz, what would have happened? She probably would have departed from the nursing profession, never to be seen or heard from again as it relates to the nursing profession. But she was in our baseline data. We were just gathering all that data for the Prophecy. Another story that I think is equally compelling is a nurse who has 35 years of experience. We will call her Kathy. And Kathy, when I was a new grad, was a manager of the endoscopy unit, and I just always remember looking up to her because she is amazing. She has a strong leadership sense, and she's got great performance improvement methodology, and when she managed the endo unit, it was the gold standard for our hospital. Everybody wanted to be like the endo nurses. They were engaged, and great outcomes came from that. I invited Kathy to the education that Felicia delivered on June 24th. And after the education, as an educator, the ticket out the door is I always ask people, tell me one thing you learned or tell me one thing you didn't learn from today's education. And Kathy shared a story. When she was a new grad, she first started in the emergency department. And imagine, not many new grads start there, but 35 years ago, that had to be pretty cutting edge. And sadly, Kathy did not thrive in the emergency department. And so she was very upset, but because she still wanted to pursue nursing, she was transferred to a med-surg unit where she was able to get her feet on the ground. She was successful as a med-surg nurse, but because of this dying need to go back to the emergency room, she left med-surg to go back to the ED and to give it a whirl. While again, Kathy was not thriving in the emergency department. She didn't have the ability to keep pace, and she didn't have the ability to assess patients with a blank slate and identify that she had to create the plan of care versus the plan of care being for her. So her manager told her it wasn't a good fit. About 15 years later, after spending some time in the intensive care unit as a staff nurse, she decided to give the emergency room one more try, where about a month after orientation, she was told again by a manager that the emergency room was not a good fit for her. So for about the last 35 years, Kathy had this sadness weighing on her shoulders because she always thought she just wasn't a good nurse because she couldn't make it in the emergency room. It wasn't until Felicia shared her knowledge, gifts, and talents and expertise with the nursing leadership team where Kathy had the revelation that she's an amazing nurse, an awesome nurse leader, and she has many gifts and talents that are suited for her in the roles that she has thrived in. It's just not the emergency department. And so when Kathy shared her story, I don't think there was a dry eye in the room because she's so well respected, and she came to terms with grieving the loss of her dream of being an emergency room nurse because it just wasn't in the cards for her behavioral assessment. And so she gave me the permission to share that story, and I hope you feel connected to that. So some of the great things that we are looking forward to the future as it relates to partnering with Prophecy is to refine our processes to assure that all nurses have the opportunity to celebrate their best selves, not just necessarily the new graduate nurses in the residency program. We are currently exploring some nurse research ideas as it relates to hiring, onboarding, succession planning, and professional development with Prophecy and using our Prophecy data as the metrics. And then, of course, we want to expand our use of Prophecy to include more professional development activities, especially as it relates to tailoring an orientation plan for both the incumbent nurse and the new hire should they move into a new specialty field. So with that, all that being said, when you look at Prophecy positively impacting nursing organizations as a whole, and when you hear very briefly St. Mary's story of how we're using Prophecy, it's amazing that nurses have the opportunity to kind of look in the mirror and reflect on themselves as they work to provide excellent nursing care to those entrusted to them all around the world. So I thank you for your time, and I hope that you have an opportunity to learn one thing that we've done at St. Mary's.
Excellent. Thank you, Teresa. I hope we didn't make you go too quickly. I know you had a lot of data to share and some really great stories, so we wanted you to get all of that in there within 30 minutes, and you did a really good job of doing that. We did have a few questions that came in. Some of them I think will be directed to you and some of them to Felicia. So Felicia, if you come back with us. First of all, some that came in earlier, this person missed the name of the residency program. Was it Versant?
We use Vizient, which is also, the name just changed from UHC ANCC. Versant is a different program.
Great. And Felicia, maybe you can help with this one. What tool is utilized to find culture fit? Do any of the competencies help determine culture fit?
Culture fit to a specific organization. I'm assuming that's probably,
yeah, that's what I'm assuming.
I know that Mercy Health, and Teresa, feel free to chime in. I know Mercy Health St. Mary's does have an evidence-based tool that they use as part of their toolkit in the selection process. I'm not sure if you want to speak to that, Teresa, from the HR perspective.
Yeah, HR calls it a structured interview guide. and it's just questions that we ask that are, for nursing, they're tailored around a professional practice model, and they're tailored around our mission, vision, and values. I hope that helps.
Great, thanks. That does help. Felicia, this might be for you. Is this platform just for nurses?
We actually have assessments for the allied specialty areas as well, including physical therapy, speech therapy, occupational therapy, respiratory therapy. We even go into the OR with the surgical tech competency assessment and many others. So we do cover a wide array of allied assessments. And we also have rad tech as well as CT.
And Felicia, I'll chime in. I also think some health systems use the behavioral for employees across the board, anything from, janitorial to public relations. Is that true?
Absolutely. The behavioral assessment, yes, does cover all components, patient-facing and non-patient-facing. So, yeah, the behavioral assessment definitely can be used in that capacity across the organization. We have several organizations doing just that. Great.
When we talk about analytics and data from Prophecy, does it come in the form of reports? I'm going to help you answer that, Felicia, because I do have a couple of slides that show we will answer yes, there are reports. But this year, coming up in 2017, we have some new reporting coming out that gives an idea of folks. This isn't, again, a product demo. We'll give them an idea of some of the things they'll look at. So if you could talk to this one, this is from the clinical assessments.
Absolutely, and this really assists organizations from a placement perspective where they can actually look at and rank the applicants to very quickly identify those top performers. So you get a very high-level overview, and there's several different search queries that you can add in to really customize to what you're looking for.
Right. Yeah, this is a static shot, so I know if you hover over the dot, you'll find out the detailed information on the assessment taker. So.
Yep.
And you can find this by those that you hired. You can filter it by those you didn't hire. So this, at a glance, this is great for a nurse manager and a hiring manager. Here's another one based on the behavioral.
Yeah, this one can really, this can definitely assist organizations to really drill deep down into the competency or the job fit for a particular job role. As Teresa had alluded to, really want to place those individuals in the areas where they are best suited, which can definitely augment your nurse satisfaction scores. So this is a great report to provide insight there.
Great. And then here's the final one regarding situational. Think how you can drill down deeper.
Yeah, this really gets to the situational, gets into those domains and those sub-score breakdowns of what the situational competency assessments measure. It gives you a nice overall job fit or overall score percentage, and then breaks it down into each area. So you can really hone in and identify areas of opportunities as well.
Do you have home care specific?
We do have a home health suite of exams as well that's specific to home health for the registered nurse, as well as the as well as the CNA. Yep.
Great. And this might be for Teresa. Would you be willing to share your interview questions?
We would be probably happy. I'd have to clear that with our CNO. But one thing I want to point out is that the Prophecy has interview questions that are geared towards each individual nurse based on how they responded in those suites of assessments.
Exactly. That's part of the reporting that's generated once they get their scores. There are suggested interview questions that align with their assessment. So that's a really good point. Thank you, Teresa. So at this point, this concludes the presentation today. Teresa and Felicia, thank you so much for joining us and for making this possible. Teresa, clearly a great story, and we're going to be looking for more great things as we move forward together. And if you have any questions at that time, you can pose those questions or come right to our website at www.aps-web.com, and there's a contact us, and I will be more than happy to set you up with Teresa and Felicia for individual questions or answer what we can. So at this time, I'd like to thank you both, and have a great day, everyone.
Thank you.
Thank you.